Hi, I'm Adam Blvd with Deliver Me Patients, and I'm here with Dr. Bryan Keropian from the Center for Snoring and CPAP Intolerance in Woodland Hills, California. Now, Dr. Keropian is a sleep apnea specialist serving, Woodland Hills and the entire San Fernando Valley. And Dr. Keropian, thanks so much for being on with me here today.
Well, thank you very much for having me.
Hey, it's absolutely my pleasure. Now, Dr. Keropian, if somebody were looking for a sleep apnea specialist or a sleep apnea clinic in Woodland Hills or in the San Fernando Valley, what advice would you give in terms of what that person should be looking for?
Well, there's several things. First thing, you want to make sure the doctor has some background and experience treating sleep, because there's a lot of fellas out there who don't have that experience, and you're liable to be one of his first, second, third patient, and he's liable to be stumbling around. So that you don't want. The other thing is, there's several ways to treat sleep in dentistry. Dentistry treats sleep apnea with mouthpieces. The reason being, sleep apnea is all about the fact that the tongue rolls backwards and blocks the airway. So what dentistry does is, with mouthpieces, unblocks the tongue. One way is to jut the lower jaw forward, pull it forward, and try to pull the tongue forward. Well, the problem with that is it can cause pain. It can also cause the jaw to go out of position a little bit, and your bite is then in a kind of a goofy position. The other way is like we use. We have a mouthpiece with a bar in the back and a little tail that pushes down on your tongue the same way your MD does when he looks down your throat, and he does it with a tongue depressor. So I would find out what type of mouthpiece he wants to use, because if he's using one that moves your jaw forward, you take the potential for having jaw pain and creating problems with your bite.
Well, that's a very interesting point that I think maybe a lot of people don't realize about sleep apnea and sleep apnea treatment, is that there's more than one way to skin a cat, so to speak, and it sounds like what you're doing there is taking an alternate approach so that people can avoid certain challenges, and I guess along those lines, what type of challenges might somebody have if they're using a traditional, CPAP device and pushing their, their jaw forward?
Well, those are two separate things. They either use the CPAP, or one of the problems is the CPAP is really, really successful in theory. The problem is it's highly rejected. 50 to 80% of the people reject the CPAP. So medicine's best treatment can't be used by the majority of people. So if you now come to if you use a mouthpiece, the big thing is getting used to it and having it not bother you, not having problems. So the stumbling block is, gee, am I liable to have pain? Am I having problems with the bulk? Those that move the jaw forward, they have a mouthpiece that fits over the top, one that fits over the bottom. They tend to be horsey, and you've got a lot in your mouth. Ours that just depresses the tongue fits on either the upper or the lower, only one arch, much smaller, much more comfortable.
Okay, excellent. Now, Dr. Keropian, if somebody we're experiencing challenges with snoring and thinks that they may have sleep apnea or symptoms of sleep apnea, and they were in the San Fernando Valley and they came to your clinic, what type of experience would they expect?
Well, they're even not sure what kind of experience they're going to get. But what they are going to get is they are going to get questioned on what's going on with them, what's their problem. We have a computer from Harvard that measures the size of your airway, and we can show you how by moving your tongue around we can improve the size of your airway so that we can get you more air. and we will show you how we would do that with a mouthpiece by using some wax. So that's the big one. The other is they're going to get a background of what sleep apnea is all about, and most of them are absolutely flabbergasted. The reason why they're flabbergasted, there was a Dr. Otto Warburg out of Germany. He got 2 Nobel Prizes. The first Nobel Prize was low oxygen in the body leads to increased cancer, infection, virus. The second Nobel Prize was abundant amounts of oxygen lead to reduced cancer, infection, virus. So when we give them this information and how that tells the whole tale of your health, because if you were to have good diet, vitamins, supplements, the best water, exercise, if you're not getting enough oxygen when you're sleeping, your body is falling apart at the cellular level. We are aging and we are causing problems for ourselves. And this is very, very surprising to them. We give them a handout about this, and that's a real shockaroo.
Now, Dr. Keropian, I know that that you do some special things for new patients. Tell us a little bit about that.
Well, one of the things is we offer them a free consultation. Come on in. We want to see you, and we want to educate you as to what the problem is. The other is, I think that the thing that we do that sets us apart is the use of the Harvard computer to measure your airway and show you how we can affect your airway with a mouthpiece, increase the size of your airway when you're sleeping so that we can get you more oxygen so that you will be oxygen abundant and be healthy for the next 20 years. We want to keep you away from the MDs. That's it.
Well, and that's really great that you do that and offer that free consultation. And I think a lot of people really don't know much about sleep apnea, that there are alternative ways to treat it. So certainly, if you're in the San Fernando Valley or Woodland Hills area and you want to take Dr. Keropian up on his offer to measure the amount of breath that you're getting and take strides toward your long-term health and potentially eliminate sleep apnea challenges that you may be having, then by all means give Dr. Keropian a call. And Dr. Keropian, it's been great having you on this segment with us.
Well, thank you very much, Adam.